Hi, my name is Mariam Totonchy, also known as Dr. T for short. I'm a Mohs surgeon, board-certified dermatologist, and as well as a cutaneous oncologist. So the first question I want to answer, which is probably the most common question I get asked, is what type of sunscreen should I be using? So sunscreen, when I talk to my patients, I tell them sunscreen is generally classified into two groups. One group are the physical blockers and the other group are the chemical blockers. Now, physical blockers are inorganic agents that physically block UV rays, such as zinc oxide or titanium dioxide. These are traditionally what we think of when we think of the person sitting at the pool with the white nose. And then on the other hand, we have chemical blockers, which are organic agents that absorb UV radiation. Usually multiple types of compounds are included in chemical blocking sunscreens to provide protection against the full range of UV light, including what we call UVA and UVB. Now, when you look for chemical sunscreens, you want to make sure that they write right on the label that they are broad spectrum, since these will cover the full range of UV radiation that can cause sun damage and the skin cancers that I treat in my clinic. So for patients who tell me that they have really sensitive skin, I usually recommend that they stick to the physical sunscreens. Oftentimes your skin can react due to fragrances or preservatives in the base of the product. So chemical blockers are more often the cause of allergic reactions than the physical blockers. And because some of the most common ingredients that we use in chemical sunscreens can be somewhat irritating towards people who have sensitive skin. So some of the most common ingredients that can be irritating to the skin in sunscreens are in the chemical sunscreens, and these can cause allergy. Some of these are called oxybenzone, patamate O, or avobenzone. For these reasons, like I mentioned earlier, I would recommend using the physical blockers if you have sensitive skin.